Vancouver Coastal Health, promoting wellness, ensuring care.
Well, thanks for coming, you guys. Appreciate you being here. I'm Dean Brown, the GP. I guess you know that already.
I'm Kelly Clausen, occupational therapist.
And I'm Angela, one of the home care nurses.
Great, thanks.
And we were wanting to have this GP Care Conference to discuss one of your patients, Mrs. Smith, who has been referred to our programme with transitioning into a palliative state. And we had some issues we wanted to address.
Care conferences are kind of part of everything we do. So there are care conferences that happen in the hospital, there are care conferences that happen on the ward as you're going around doing things and as you bump into colleagues. Sometimes you have informal care conferences, but the kind of care conferences that we're talking about now with community care conferences involving the GP and the rest of the team are really just kind of a recent innovation as we've come to be aware of the need for that kind of coordination between professionals.
Usually they're about 15 minutes, I would say, and it's a really good opportunity to collaborate with the physician, family physician, and the other healthcare professionals on the team.
Okay, can you just give me some background? Because I mean, I know this lady, obviously. She's been my patient forever and the family and everything. And then I know she's had the breast cancer, and I've kind of lost track of her through being at the cancer clinic and everything. So can you kind of update me on?
So this lady, Mrs. Smith's a 7 to 8-year-old lady with metastatic breast disease, and she's transitioning to palliative care. We received a referral from the BC Cancer Agency. She's moved in with her son and daughter, which she's not that happy about. And she, as you know, she's been your patient for the last 20 years or so.
I think it was that informally, I think we've always recognized, all of us involved in care have always felt like there's a disconnect between some of the parts and that it would be better if we got talking to one another, but the system just wasn't set up for it. And in recent years, the systems kind of realized that and realized that, well, we have to make those connections. Things just aren't working the way they should. And so there's been some kind of top-down efforts along the way to get us talking to each other, and I think we all feel like, yeah, it's the right thing. The question is the nuts and bolts, how do we do it and how do we make it right, how do we make it work?
I would say no, it's not typical. It's hard for everyone, if there's a lot of different clinicians involved, to get everyone's schedules to jive with the GPs in order to meet. So a lot of times it's just more efficient to have it over the phone. The home health clinicians can meet together in an office and usually contact the GP at their office or sort of wherever it works. But if it made more sense in the situation to have the client present as well, or to have the clinicians together, then sometimes it could be done in the client's home or in an office with everyone in the same place. It just depends on the situation. So, I mean, there's a few things that I've recommended. It's a bit cluttered down there. I mean, it's a new environment for her as well, so it's going to take a little while for her to get familiar with it. Her strengths, you know, she's weaker, her balance isn't as great.
Wow, those are big changes. Like, that's a lot for her to take on. And then I've been seeing, like, the son in the last little while, and he's mentioned some of this stuff to me, but I didn't realize quite how big an adjustment that was, like, for her, obviously,
Yeah.
but also for the family and moving in with them and everything. So it's all quite a big thing.
Well, I think they have. I think when we're all there to help one another. Often when we ask some of these questions, if the GP doesn't know the answer, we don't expect them to know the answer. We'll help them through our system, the bits that we know, and then they can help us through the bits they know, and then we all work together to just try and collaborate.
Okay, well, I appreciate you coming in.
Yeah,
and,
thank you.
Thank
yeah,
you.
it's obviously important. We'll probably be talking again as we go along, maybe. Yeah.
Sounds
okay,
great.
Great. Thanks
Thank
very
you.
much. Great.
Thanks.
Yeah, I really recommend them. I think it's the only way to go. I think our system's been too fragmented historically, and that we're all trying to do things in little individual silos, and that we can be more efficient and effective if we connect, break down those silos a little. So I definitely think it's the way we have to go in the future. Well, specifically, to get in touch with the North Shore Home and Community Program, it's just phoning 604-986-7111, which is, I think, a number that most docs almost know by heart now.
Vancouver Coastal Health. For more, please visit us at vch.ca.